together to understand what we need to do. One of the things, there was one thing in particular. There's a lot of things that grew out of the coalition, but one thing that really grew together that I think this group would really appreciate is the Kansas City Children's Campus, where there was Head Start and Juniper Gardens Children's Project, and there were several groups that came together, and so we looked at the feasibility of building a building where people could work together and there could be research, and that it would be evidence-based education for children, and that is something that came to fruition. So there's a lot of things that grow out of coming together in humility and working together for community.
Thank you. All right, so Matt, this question is for you. As we recently learned that you were a star basketball player for KU, so how does one make the transition from D1 basketball player to urban planning and now community engagement?
Can you all hear me? Okay, I appreciate the question. If you watched me play, you must have watched really carefully because I didn't play very much. But my experience was I went to KU, I studied architecture, I played basketball, and I thought someday I'd build stadiums. But then when I got into the real world, I realized that stadiums often tear down neighborhoods. There's oftentimes historically marginalized neighborhoods, and they only get used about 8 to 10 times a year. And I thought, well, what does the community really want? And what the community wanted was grocery stores. And they wanted safe parks for their kids to play in. And they wanted sidewalks. But nobody really teaches you how to do that. Nobody ever really teaches how to build a community. And I got to give credit to Dr. Nikki Nolan, who's in the room, because she sat down with us early on and she talked to us architects, and she goes, well, we're here in the School of Public Health and we teach kids all the problems of the world. And you're in the School of Architecture and all you do is try to solve problems. And I kind of took that as a challenge. I took that upon myself because I was teaching at KU, and I thought, how do we take all of these social determinants of health that we know affect our community's health at the level of the built environment and actually design with community in response? And so I was fortunate enough to have a teacher in this work, even though there's no degree. My teacher was Broderick Crawford. And Broderick took us along. I worked with Reverend Eric Williams when I was at Children's Mercy developing the Kansas City Physical Activity Plan. I worked with Broderick and Mariana and many others in the room and in this community on the Health Equity Task Force as we launched neighborhood-based clinic locations. And now we would do a Vibrant Community Advisory Council. And what we realized is a lot of the deficit in this community engagement work is trust. There's such a breaking of trust between local government, between health officials, between communities. And early in our .agency work, we kind of uncovered there was this sort of secret sauce. There was a research article that they did on what actually amounts for trust building. And it was 3 things. Number 1, be present. Be present in the community. I moved to Wyandotte County because Broderick Crawford was bringing me in 4 days a week. And so KCK is my home. Being an accessible resource that shares freely. We are frequently showing up in spaces and saying, what do you need? Do you need a map? Do you need a photo? Do you need a video? We may not be able to build you a building today, but we can organize an event. We can do things with you and just share what we have. You don't need to write a grant to get what we have. We can share that with you, and that builds trust. And the third thing is to get shit done. And so we're working on this really big clinic right now. But we knew going in that we had to build relationships and do things without people expecting it to be exploitative. So we built this Broderick Crawford basketball court to honor Broderick's legacy. But it also shows the community that we're serious about partnering with them and doing this work with them and seeing that it's real. And I think that's helping us sort of repair the trust, at least in the Northeast area of Kansas City, Kansas.
How many people know Broderick Crawford in this room or worked with Broderick? Oh, this is a great time to tell you who he was. Okay, so you might know more than me about Broderick. Broderick Crawford was and is a force to be reckoned with for Wyandotte County. He was tireless in his pursuit of ensuring that the people of Wyandotte County had the best that there was to have, and even sometimes beyond what there was to have. He was the very first community PI to be involved with Frontiers. And one of the reasons why we created our community advisory board and why we have so many, our MARG, which is a multidisciplinary advocates and researchers group, is to make sure Broderick is not the last community PI on a major project. And so we did create the Broderick Crawford Community Partnership Award to ensure, or, you know, just to help make sure that there are people that are doing the work in the community and that they can partner with investigators and they can get more experience, and hopefully Broderick won't be the last community PI. And you got, say more about Broderick, please.
I'll just add two things. If you want to know what Broderick's legacy is, go to 803 Armstrong in Kansas City, Kansas, and go visit the Community Health Council. And there's a mural where his face will greet you in the back room. And it's a beautiful mural by a local muralist, JT Daniels, but it gives you the spirit. I don't know how many murals we find of community leaders that fill up an entire building's wall. But Broderick is also memorialized at the basketball court we finished at 750 Walker Avenue. And if you want to get Broderick's spirit, attend New Bethel Church on a Sunday morning. And Reverend A. Glenn Brady will welcome you. And if you say, I want to learn more about Broderick, he will talk to you for as long as you have time.
Decide. Exactly, yes. So if you don't know who he is, we encourage you to do a little bit of research, and his legacy will live on through so many things, and along with our Broderick Crawford Community Partnership Award, which leads me to my next question, actually. So Linda, this question is for you. As a recipient of this mini grant, what led you and Mariana to even work together? How did you meet each other? You know, because we know what your project was. But how did you meet? How did that even come about?
That's a story. So Mariana and I have known each other through church. We both go to Good Shepherd Catholic Church. I am an assistant professor in the Department of Physical Therapy at KU. And I had no idea what Mariana did, but we would see each other, we would wave at each other. And then once we met in the hallways at KU, and I was like, oh, what are you doing here? And she goes, oh, I work here too. I was like, oh, okay. And she told me she was the director of Juntos. And then we started talking about the research that I was doing. And at that time, I was looking at people who had suffered from a mild head injury, just trying to pilot a rehab intervention. And I said to her, I said, you know, I go to the neurologist clinic every day and we look at the list of people, and I never see the names of any Hispanic people. And I said, where do you think they might be going? Like, where? I'm sure they're having head injuries. And so that's when we started talking. And I, you know, like, I know you all are saying that Broderick, I've never met Broderick before, but my guide has been Mariana. So I would say she's my teacher, you know, and we started talking, and she was like, Linda, this will be a great project. You know, let's look into it. Let's see what we find out. And we found that the Hispanic population is overrepresented in the roofing industry and in construction. And we didn't know where they were going. So I had my researcher hat on, and I was like, well, if we do this project, then, you know, let's go ask them, you know, do you have these symptoms and do you get dizzy? And she goes, no, actually, we need to just meet them where they're at and ask them what is important to them. And so this was a brand new adventure for me. I had no idea, I have no experience in community-based research at all. And she started introducing me to words like, you have to build trust, you have to ask the questions that the community is interested in. And she introduced me to a church group called Grupo de Parroquial. I'm not even saying it correctly. But they are a church group at Good Shepherd. And they were like, you know, we can talk to them. They have a trusting relationship with the community, and they will be able to help us connect, ask the questions that we need to ask. And again, we had our first meeting, and I had my research questions and my statistical analysis, and I would do a t-test and this and that. And she asked the first question, what do you think? And these were just community, just part of the community. They weren't really somebody who had had an injury. And when they started talking, I was just blown away. They were just like, there are so many issues. What issue were you thinking about? And I was like, I don't know. And they were like, well, there's language, and there's immigration, and there's difficulty accessing the healthcare system. And so they gave us so many ideas of what to think about, that I actually took a step back from just a head injury and said, let's just listen to any worker who has had an unintentional injury at the workplace and how did they navigate that. And then we went through the whole process of writing it out, writing the consent form, which we tried to keep very simple, making sure that we didn't ask a lot of questions that would deter people from joining the project. So, we didn't ask for phone numbers, we didn't ask for addresses. We said we would compensate them with a card, but we didn't, it was just like, I'm gonna give it to you. So we don't know how you spent it, we don't know what you did with it. And it was a very eye-opening experience for me. We tried to meet the people where they were in the community. We tried to make it as open and welcoming as possible. We tried to meet people in the community to get some of our questions answered. Yeah. And I'm happy to share the results. Like, we did get some really, do you want me to?
I mean, yeah.
So we talked to 10 people who had unintentional workplace injuries, and they all said that they had difficulty navigating the healthcare system. They didn't know, after the injury, there were a lot of barriers. They didn't know whether they should talk about it, if their job was at risk. There were a couple of people who did lose their jobs after they had an injury. I think those were just things that I had not even thought about. If they did go to the doctor, they didn't have a support service to, the language was a problem, getting there was a problem. So it really even wasn't sometimes getting to the healthcare provider. It was the steps in between. And when they did get to the healthcare provider, a lot of them felt that they were not heard. And so that was a really eye-opening for me.
A follow-up question regarding, so you had a relationship already naturally from the community, and then that grew into this. What were some of the challenges for you specifically as a scientist, as a clinician, to overcome to do a project like this, getting feedback from someone who you're like, oh, we're gonna partner together and we're gonna do this thing? You mentioned some of them, but could you just say a little bit more about that?
I'm a quantitative researcher. So I do an intervention and I look at people before and after. And so that was my approach. Like, these are symptoms. Let's see how many symptoms they had. And I was like, after they had these symptoms, did they, I was still interested in the roofers. Did they go back on the roof? And what if they had a second injury and things like that? But I think there's bigger things than the injury and dealing with the injury. There were a lot of things where people were having difficulty even coming out to talk about that injury. And that was something that I had not thought about. So that was interesting.
All right. Ms. Lippran, this question is for you. And so we've had some really candid conversations, and we've talked about some of your work as a longtime advocate for the lupus community. So in your role, what have you seen as the most critical needs for lupus patients and survivors?
Oh, let's get
No political correctness. We want you to tell us.
One need is people to realize it is a problem. I think when I first met you, I think I ran up to you and said, hey, this is going on. You were like, whoa. So anyone knows me, anywhere I'm at, I talk about lupus. We cannot talk about lupus when in our community, last year we lost 7 people under age 25 because there's no doctors looking at it. It's the same that when they are diagnosed, you get pushed to this doctor, to that doctor, this, and especially if you're Black. And when we did our focus group, the main thing is no one's listening. no one knows what lupus does to a person from head to toe, but also mentally. And the other thing is the cost of medicine. If you don't have good insurance, and I have good insurance for my husband, but I have a medication. If I didn't have insurance, if I was on Medicaid or market insurance, it would cost me $5,000 a month. No one's talking about that. No one's telling the people that is in that situation, okay, where's the steps you need to take to get that lower. Not in my community, they're not. So when we really did our focus group, which will help you, because I was talking about it constantly, and everybody just looking at me, you only know you to have it. It ain't that serious. That's when we did our focus group and was say, just like you, we don't even know nothing about you. We don't know who you are. Just tell me your lifestyle. What is your journey? It was sad. I don't go to a doctor because no one's listening to me, so why would I go? I don't go to the doctor because where am I going to go? And then you look at when they do go to the doctor, they're going to the ER. Now they got bills and bills and bills. They're like, what I do? And what we learned is, one is education on both sides, not only just the lupus community itself, knowing how to navigate this community and the medical community, but also the community on the medical side. Because you talk to a lot of doctors, especially internal doctors, they'll tell you they don't know anything about lupus. And when they do realize what it is, they don't want to deal with it. They keep pushing you back. And it was an article written maybe 2 or 3 years ago in the Rheumatology Association, where if every major city have a true rheumatology, we'll be doing great. And it's proven here in our area. Because we only have about 50. Out of that 50, only 35 are actually patients. So what do? We have almost anywhere on a good, in the greater Kansas City, about 9,000 plus people that's dealing with this. Out of that 9,000 plus, we found out that most of them don't even seek any medical treatment because hey, I've been talking about this for years and no one's listening to me. Because it takes anywhere from 3 to 7 years. So education is such a huge thing. And also research. Research is huge with lupus because we have a problem. Because as we know, Black and brown do not like clinical trials. We need Black and brown for clinical trials. But I think with the clinical trials is how it's working. Because all clinical trials are not all about, I'm going to take your blood, I'm going to give you some medicine. Some of it's just a questionnaire that people could take out and really see the outcome and the journey, the long and lonely journey that lupus patients have. But most of the times when clinical trials are introduced to us, community, it's wordy. They don't understand the wording. They don't understand anything because all they say clinical trials, because we know we've all been, Black and brown has been experimented on, and they're like, I'm not going to do that. But if they bring it to them in a more of a passionate way, and meet them where they're at in their community, it's a difference. Because I have a lot of people now with some partnerships that I have already 20 people that actually is now doing clinical trials. Because it's the way you're speaking to them. So education is huge and research is huge.
So that's your number one. That's
Yes.
your number one thing about it.
So we always talk about you being like, you are a fighter and a survivor. Of course, living with lupus for more than 30 years when you weren't initially given 3 years. And so that spirit has really made a difference. But seeing that we're in this room now with a lot of clinicians, a lot of researchers, what are 3 things that we could do to help improve the landscape of research so that lupus survivors might be more receptive to learning about research or participating in research in the future?
Go where they're at. If we actually look at most national organizations, they don't look nothing like me. And most of the people that have lupus looks like me. So first thing, you need to go where they're at to learn how their everyday reaction is of everything. Because if someone who came up to me and told me about clinical trials before I actually start studying clinical trials, I would say no. Understand whom you're talking to, I think is number one. And when I say that, I don't mean dummy down. I'm just saying understand who you're talking to. So everybody has, if you don't meet them where they're at, you're never going to get their participation. That's it. And people always ask me, why you always, the local nonprofit with lupus came to one of my events, and they're like, how do you get over 20 people to your events? When we do something here, we can get 2. I'm here. Most people in the community knows my number. They stop me and say, hey, my sister's having a bad time. Can you contact her? No problem. Where she live? What do you want me to do? You want to the hospital? Where do you want me to be at? And I think that's the problem. If they can't see you, talk to you, and if the older they get and they can't touch you, they don't want anything to do with it.
Thank you so much for that. Earning the right to be heard and also being where people are, because nobody cares how much you know until they know how much you care. So thank you so much for that. Okay. And I'm going to just open that question up for the rest of our panelists. We are here in a room full of researchers and clinicians. What's something that we can do, and I'll start with Matt, to make sure that we're continuing that legacy of Broderick Crawford and engaging the community in all phases of the work that we do, and showing up to build the trust and to show that we care and we're not just here to collect your data and move on to the next thing a few months later.
I don't know if I have the best answer for that. I mean, I think the challenge is I think people want to be heard, but they also want to see change. And I think as someone who's taught students, who's done the community engagement circuit where we kind of go into the community and we do photo voice and we leave the community and then nothing changes. I think there is a risk. There's a real risk that we can build false hope, and that we can create an environment where the burden is disproportionately placed on those who are already challenged just to get through their normal day. And now we're asking them to show up to a community event that's uncompensated and it's taking time away from their family. I think there's an ethics in participation. I think there's an ethics that we as practitioners and as experts need to hold ourselves to. But I think the bigger thing is, how does the institution reflect this commitment? Is the institution located in these communities? Is the institution buying catering, and is it hosting events in the spaces where our local economies are oftentimes what is to blame for our health disparities? When there's no opportunities, there's no employment opportunities. Are the institutions that we are a part of taking an active role, actively locating in the communities that are most impacted? And if we're not doing that, we need to have that conversation internally as well as externally.
You use the mic so the people on Zoom can.
Also put your dollars there too with us, because trying to do this as a grassroots person, it's a lot. Everything costs, even though they say, you're doing a great job. Yes, I believe in you. But we love their encouragement. We love people knowing that we have people's backing, but also the dollars is what we need also to make it, bring it to the community, do the events we need to do, talk to, and honestly, not, being fair, also bringing people into our community, like this year we're trying our best to bring a summit here to Kansas City about lupus. But that costs, and trying to do it as truly a grassroots organization is pretty hard. So when you see community people out there trying to do the best or do the work, put your dollars behind it. Not, yet I love the volunteering and you're there on my side, but just like when I spoke to you, you were like, I can help you with that. Just have that conversation too.
If I can just add more to that a little bit, I used to teach at the KU School of Architecture, and I loved the opportunity and the bright, minds coming to Kansas City, Kansas. But then I realized there's a lot of white kids from Johnson County and St. Louis and Chicago coming to KCK to get something out of the community, and then they wouldn't actually be able to finish what they started. Like, we could build a mobile grocery store, but that doesn't build food security for thousands of families. Like, we could dabble in it, but we really couldn't solve it. And what I've come to appreciate is that the brilliance in our communities and our youth. Our high schools and our communities are stocked with brilliant minds, and they are oftentimes zero or first generation immigrants, but they're families who are struggling to get by, and those kids are brilliant, but they are not getting the opportunities they deserve. And I would encourage you, if you all don't have some sort of youth advisory panel, something that gives them a chance, create one. Take it upon yourself to create some form of opportunity, because those kids need opportunities as much as anyone. And we have our second annual Vibrant Community Internship, and the kids blow me away. They are unbelievable. But what is happening for you in your late stage career, give those kids that leg up so that they have that opportunity to break the cycle that we're seeing too often for decades in the communities that we're serving.
Yeah, I'd like to say that because I think the reality of our situation in the world is that there's going to be a whole lot less money. There's going to be a whole lot less money. And we have to start looking at human capital. And when we talk about human capital, we talk about disagreements and the turf issues that enter into it. But I think as a country, we're going to be having to come together to support one another, and your connections, all of our connections to community, are going to have to deepen, and we're going to have to build trust. When we started the coalition in 1992 with 5 organizations, over 10 years, it grew to 400 organizations. And when that type of interaction is happening and there is work being done, you're also touching nerves of people in power who don't want that work to be done, or they don't see that that outcome is what they envisioned. And I have been in, to speak to your point, I've been in more rooms where the 7-year-old said the smart thing, and that adults would look at a child and realize that the truth was coming from that. I think we need to prepare ourselves. I don't mean to be a downer, but I think that we need to absolutely be preparing ourselves to think about things differently. To invite is probably a really, really important word. Don't just think that people are going to show up. You need to invite them. And then you have to set a safe table. And then you have to approach the interaction with humility. Humility is the key word. You have to be humble, because you're going to hear something that you didn't expect to hear. And that's okay, because we're all going to be learning. Thank you.
And I will agree with Sandy on the human capital. We have to build our community partnerships, and that's what I feel like we did well in our group. We met with the community partners who were interested in Latino health, who wanted to meet with us. We went through the research process with them. We did a little bit of training, so they didn't feel like they were not part of what we were trying to address. When our study was done, we got back together with them and shared the results. And they were excited to hear the results of our study. So they knew we were coming back, we were sharing with them. They had so many more ideas for us, and they wanted to stay involved. And I thought that was really interesting. They said, what can we do next? What help do you need next? How can we, and we were like, we want to move this forward. We want to do something different, new, and build on the project that we have done. And they were like, where can we help you? And so we specifically said, if you're interested in advising us anymore, who else should we talk to? Let us know. And so we're getting more information from them as we are moving forward. So I think that human capital and just building their, like Mariana says, building capacity. That is what we are trying to do to keep this movement going forward. Although I will say we have encountered some issues in the last few months. So,
It's a whole.
Yep.
You know, itself. Just about that. Can I just ask, what advice, do we have any community members in the room, people that are not necessarily solely investigators? Do we have people that, mostly people here? We have LaShawn, Corey. I'm just interested when there is someone that is from the community that has an idea, like, we're talking about deepening our relationships, and we're talking about don't stop at just inviting people and making sure that they are invited to the table, the proverbial table. When they have identified a need, what do you suggest that person then do that we can share with these investigators and clinicians and researchers in here? And then I'll pose it also to our community members as well, but do you have any suggestions for me? I'm not connected to KU, I'm not connected to any institution. I just know that lupus is a problem and I don't know what to do. I'm coming to you because you seem like you know what to do. So what should I do now? What are some tools that we can give them?
I can just tell you real quickly, how many of y'all have ever heard of the parable of stone soup? The stone soup is this idea that you want to make a stew for everybody, but you don't have any vegetables. So you start knocking doors and you ask the next neighbor to throw something in. They don't do it because they don't trust you. They don't know you. So you start heating up some water and all you got's water. You start throwing in stones and you're making some splashes. And all of a sudden you're stirring and people start looking out their windows thinking, I'm gonna throw in what I have. As a practitioner, each one of you in this room has something. The community is making stone soup all the time. You got to figure out what you have that you can throw in. So what I have is photography. I oftentimes bring my camera to community events. I take photos, I do videos, and then all of a sudden I'm taking them on my phone, getting their cell phone number. I'm sharing free photos. Free photos goes into their next grant application. It goes on their website. It goes on their Facebook page. It increases their presence online. That's that sharing accessible resources. Each one of you has something that you can share. So you don't always have to say, well, come to my table. Those tables are already being made left and right. You just need to show up to theirs and throw in with them.
Give this lady a microphone.
I will say this, and I can only speak for me. When I say I'm grassroots, they know I'm grassroots. No one was talking about lupus. So everywhere I went, I talked about lupus. I talked to my doctors, I talked to the nurses, I talked to anyone that would listen to me that, what's going on. And eventually people start knowing me, not by who I am, but, oh, you're the lupus person. The lupus person. And then even to this day, I still have doctors calling me saying, hey, can you give me some advice about a patient? And that makes me feel good because I see someone's listening, just one person. But if you have a cause or you feel like you have a purpose, I really would suggest, just like I did, run up to her and say, hey, can I tell you about lupus? What kind of research are y'all doing over there about lupus? That's the only way I knew how to do it. I think in our earlier class I was in, when they said the best way, I think you all taught me what I needed to do. I didn't know what I was doing. I didn't know. So if I didn't know, I just kept asking and asking and asking. Because everyone has a cause and everybody has a why. It's just getting someone to buy into your why. And normally when you do that, it's hitting someone at home. So I would just keep talking and talking and try to find someone that's doing or wanting to do some kind of research with you. And that's what I found. It was hard to find someone to do the research or help me say, okay, I see it. I need more. And then, okay, I do see it. Because if you don't have where to go, we don't know where to go. Because I didn't know until I'm literally, when I say I ran up to her, the meeting was over. It's like, hey, you said you were from church emergency. Come here. I didn't talk to you. So, because I didn't know how to start. And she's the first person. I've done it several times with everybody, but Andrea was the first person. I know she looked scared because she was like, here, call me. And I did. And we started talking and talking and talking. So if you, I mean, just, I think as a community person, sometimes we don't know how to get to you all at all.
I'll speak as a guinea pig here for a minute because I was a guinea pig last year. I was part of a research study. I was referred by my knee doctor to a program that was being done on weight control and that sort of thing before surgery, and it was a phenomenal experience. And one thing that I've done with that experience is I've shared it with friends, I've shared it with family, I have talked ad nauseum about it, and other people were impacted by my results. That will never be reflected in research. However, I have had people call me and say, you had such a good experience. Do you know of any other studies? Or, I think sometimes physicians don't know who's sitting with them. And so, or researchers even don't know the possibilities that could extend from the person that is being, or the group that's being studied. And so just asking that question, and I think that's important. Just asking questions, being curious.
And I just wanted to chime in and say that as researchers, being willing to listen. I know that we're all busy. Our calendars are full. We've got emails to respond to that we haven't yet responded to. But I just think if, I hadn't taken the time and said, okay, let me hear you out. And even though I don't do lupus research, what tools do I have that I could bring to help? What stones from the stone soup can I bring to help with this process? And I think that 5-minute conversation led to many other conversations, but that doesn't happen without taking out the time to listen and to hear the need and to speak and know that I may not have all the answers, but maybe I can point you in the direction to somebody who does. Or, wow, your timing is impeccable. There's this mini grant opportunity. Have you ever thought about that before? But just kind of thinking about what can you do to help support these types of community research partnerships? So.
Yeah, I do agree. When I think listening is the key. And so when we had our returning of the results, just listening, these are all of our ideas. And some of the ideas were huge. They were too big for us to even talk about immigration and things like that, which we know, they're out of our control, but just acknowledging, I hear you. It is a big problem. We're going to keep that open. It's an open book. And then also being honest, like, yes, it is a big problem. I think just verbalizing, hey, the climate changed a little bit. We are still listening. We know what you're saying. We may not be able to do much right now at this point, but we've heard you. And I think that that honest response, I think, does keep the community partners engaged, that you hear me and I want to talk more.
I think this is a great time to do a shameless plug for Frontiers in our community engagement program. We're growing our program right now, but if you are paying attention to what Frontiers is trying to do, you're all connected to Frontiers in some way. If there is an issue, or a community person and they want to tackle something and you are not familiar with it, send them to me. I'm connected to so many people, and I might not have the answer, but I might have someone who can lead them to someone who can lead them to someone who can get them an answer, or who can guide them, or who can be their teacher, actually. I think that's the crazy part about LaTanya specifically, is she comes into these rooms talking about something that's impacting her and changes the lives of the people that aren't impacted by it at all. I mean, I have talked to so many people, I'm like, oh, you have lupus? I mean, oh, I have someone you should be connected to. And just knowing that the small things that we all do can just piggyback and roll and roll and roll and roll. And I like the stone soup thing. I'm gonna make that mine. Who is that? I mean, like, what is that, like an indigenous thing, or is that like?
There's a children.
It's a children's book? You all know about the children's book? I'm the only one? I have 2 children and no one told me. Okay. Okay, it looks like we have a question from the audience, which is a great time to say, we are opening this up. We do have 2 mics, and I can do the walk. She has these bad heels. Man, them heels are bad. She has these great heels on. So I'm happy to do the walking. If you do have a question, just put your hand up and I'll come to you.
So here's my question to the panelists. Someone who is not from Kansas City and is learning that Kansas City is in 2 different states. I'm really interested in understanding how you're doing your work in Kansas City. And someone mentioned that barriers and borders. And so is it in one portion of Kansas City? Is it in all of Kansas City? I'm just trying to understand kind of the dynamics and how do you do your work when you say Kansas City? Is it Missouri? Is it Kansas? And yes, I said Missouri because my family is from Missouri.
Well, yes, it is Missouri, just so you know. And there, and there will be other people who say it's Missouri. Our history is very unique and interesting. And literally, I could write a book. I mean, there are so many things. I've been in meetings. I have facilitated many hundreds of meetings, and there would be people who would raise their hand and say, I'm from north of the river. Do you care what I have to say?
Hmm.
And so people are coming into meetings with the assumption that they're not going to be heard. And so you have to set the stage as a welcoming to be able to hear, and sometimes you hear really hard things. And you have to work through those hard things, and you have to be able to hear those things. So we've got rivers, we've got state line, we've got counties, we're famous for redlining, which was, saying where Black people could live. And I mean, it was just, we've just got a history that we're still learning to get over. Did that tell you, is that what you needed to know? Oh, I will write a book. I mean, I don't know, you do have to invite people together, and the thing that I have been focused on for 30 years really is coming together around issues. When people when we had a coalition and people would come to us and say there's not enough social workers of color, so we would work with UMKC to start a school of social work. I mean, there's all these, and that took years, so none of this is easy. But getting people to the table is very important, and being welcoming at who comes to the table. Yeah, you and I could talk for hours, I'm pretty sure.
I'll just add from an architect's perspective. From my perspective, neighborhood matters. If you're doing your work at the scale of a zip code, you are missing so much richness in community space. So the work I do, I try to be in the spaces where I'm walking neighborhoods, I'm in parks, I'm on sidewalks. The work I care about, I need to be at that scale of. And I'm not trying to work across state line. I worked in KC for a long time, and it felt like it is 10 times the size of Kansas City, Kansas. And it always felt like there was somebody who was going to figure it out. No matter what lane I was in, somebody was already there. And I crossed the state line to KCK, and it felt like there's nobody here. Like, there are folks who are doing the work, but it's not nearly as strong of a community to be in that service space. And so as somebody who wanted to build healthier communities, like, I look around, there's nobody, which it gives me some latitude as a professional to dip my toe in spaces that I otherwise wouldn't be in. So now I've done food access and housing access and transportation advocacy. And like, that's great for me personally, but also means I need more help. And so, like, I look at places like KU Med, who I love dearly as partners, but they're on the southeast tip of Wyandotte County. And the neighborhoods I work in are the neighborhoods that white flight fled from. And that's where I think there is a argument to be made that look at the county health rankings, look at where the average life expectancy is lowest. If you want to be in those spaces, you got to be there day in, day out, get to know the neighbors, get to know the formal leadership, get to know the informal leadership. And I think if you define it at the scale of neighborhood, there was a urban planner by the name of Clarence Perry in the 1920s who talked about organizing is strongest at the scale of the neighborhood unit because your interests are my interests. Because if you live on my block, you care about the school district, you care about the post office, you care about the neighborhood park, you care about the kids walking down the street. So that's where we try to work. But that's at the community development side, and it's different, I know, depending on where you all are at when it comes to public health.
LaShawn, let me give you a different perspective. As a foreigner who moved here in the middle of 1996, I was surprised at how many people didn't realize that the Civil War was over. And for people who think it's tongue-in-cheek, Matt may remember 2008, one of the years when KU had a competitive football team, and they were going to play Missouri. And there was like the Casey Star, this is so long ago, the Casey Star actually had a print version. And there was a 2-page spread on the border war. And while there have been some bi-state initiatives like the train station, renovating Union Station, there still are some differences between the two states that maybe are not quite as apparent to people who've lived here their entire lives as they are for those of us who've come in from the outside. And I think it does provide challenges for, truly cooperative activities. And we just have to get over it. And part of the border war thing is Missouri was a slave state and Kansas was a free state. And the border war was a real phenomenon. And you still see vestiges of it remaining at the political level.
I feel like there's one more thing I gotta say about and I could probably talk to you later, to be honest, LaShawn, but Frontiers, our catchment area, as you may have already heard in the morning, includes some of Missouri and Kansas. And while it does present challenges, when we come into these spaces, I have to ask, oh, are you on the KCK side or the KCMO side? So the people that care, that are there to do the work, they don't care. They don't, I think that's answering, like, how do you do it? The people that are there are like, okay, let's just do the work. Occasionally there are federal issues like funding, like, oh, I can only do this in Kansas or I can only do this in Missouri. But that doesn't mean that the people that attend have to only have that zip code. And sometimes if we're asking for zip code, we still will just for data purposes, just to report out, because it's good to know, but that doesn't restrict too many things from happening from our perspective. Okay, I just had to do that last little thing. And I think we have some other questions in the audience and I can run up. Well, she's close, those heels.
I've been walking in heels since
I know. She said, I've been walking in heels since.
I'd like to speak a little bit ask about the human capital part that was mentioned. Do you have any advice on how to integrate neighbors or a community or community members with different backgrounds, or perhaps even like language barriers, like a neighborhood with a mix of people who speak different languages? How, or like any advice on like bringing those people together, just so like neighbors can introduce themselves and know who is living next to each other. My family lives on 10th and Parallel on the KCK side. And at one point, my great-grandparents owned a lot of the houses and they knew everybody in the neighborhood because they rented those houses out. But now they're not in their possession anymore, and they've been bought by, Spanish-speaking neighbors, and there has yet to be that, connection. There's like some feelings, about that. So what is some advice on like pushing past those like preconceptions and, you know, racial factors, you know, that come into like how we think about other people so that our communities can be more integrated and we can build that human capital?
You start with one person. And food is good. Food is always good. I used to work at a Section 8 housing. I didn't work there. I volunteered there, but trying to bring residents of a Section 8 housing complex together. And it was located in Kansas City. That was 1.5 miles from the closest bus stop. In other words, there was no transportation to get to work. So, I went door to door. And I knocked on the door and said, we're going to have a meeting. And the first meeting, we had one person. And usually that's, this is an overstatement, a cantankerous person, somebody who's just really, let's just see what this is about. And I would make tuna noodle casserole because that was the cheapest thing. And then after she had a good experience, then she would tell other people. And then you'd see it start to grow. And before you know it, we were inviting police officers in and the bus company in to get on the bus route. And so that people were learning to advocate for themselves. And once people began to, I think it takes a little bit of a facilitation, just somebody to set the stage that's safe. So, and the cool thing about a multi-ethnic community, like you're saying, is you have a potluck. I mean, food is always, the stone soup is good, but it's also good to taste other people's victuals, so to speak. So that's one way to start.
Let's talk after. Because the project I'm working on is at 13th and Parallel. My office is at 13th and Troop. I live at 18th and Washington. And we've already canvassed door to door in the neighborhood. We host monthly meetings. We have every other month or every third week of the month micro events with the community. You're asking the right question. It is not easy to solve. I can tell you from experience, one of the things that we're all somewhat guilty of is we expect our young people in those households to be the translators. And in our internship last year, we had young people come to us and say they wanted to do a zine on the barrier that they're having to translate for their parents, really tough information, whether it's immigration or health or how to see a doctor, and it's creating secondhand trauma for our next generation because of the exact same issues you're talking about. And I've heard from community leaders for 10 years in this exact neighborhood, Strugglers Hill, OCP. I'm working with them every day, and they're telling me it's hard. And I went to an Oak Grove Neighborhood Association just a couple weeks ago, and they said, we want to have a Spanish speaking class. Who's teaching that? How do we get that together? So like, there's a desire, I think, on both ends, but also with the federal climate we're in right now, it just took on a whole nother meaning to have people knocking on your door and gathering in space. And so I don't think there's an easy answer. I do think what we're talking about is something that's important. And it's going to take questions like this and building relationships afterwards to say, okay, who is the first person? Who's that church leader that's around the corner that can help be that safe and trusted place? And I'll point to Mariana Juntos, who taught me this, is that sometimes it's not just about the geography. So it could be wildly outside of the neighborhood, but there's a safe and trusted place where people are willing to gather and have those conversations. I think you need to find those as much as you need to find the individual.
I was gonna say churches, the Divine Nine. These are the people I went through that, hey, see me. Also, I know a lot of people are scared to talk to their doctors. Talk to the doctor. Find that one organization or that one person that's in your community that you know that one person that everybody listen to, even though it's wrong, they still gonna listen to them because regardless why, because I don't know, mother said do this, so we doing it. Just find that one person that has other people's ears. Even, and I know sometime in our community, it's kind of, people feel kind of standoffish, but just, hey, I got a question. How do I get this started? So you have your home association. I'm not trying to be funny. our Girl Scouts is our biggest thing in our community, in my community. They rule our whole community. So you get the, we got the Girl Scouts parents together and we got stuff done. I don't know why, it's just besides them hustling the cookies, they can get stuff done. But find that one that you know in your community and try to partner with them.
Yeah, for our project, for our little group, the church was really meaningful. And we had representation from all age groups in that church. So we had older adults, we had young adults. And so I thought we had a really nice discussion every time we met, looking through the lens of different people. And as we were concluding and just kind of sharing our results, even the small group that we had wanted to continue. And they said, oh, we should build our group. We should make it bigger. We should invite more people to the table so we can actually go out and we can talk to people and we don't feel like we are spread thin, but we have enough manpower and resources to be able to continue. So I think once you get your little base group, then you can kind of light the fire and then they can start talking to each other. And I think that's a really good step forward.
We have about 5 minutes left. I just want to say that if there are any last questions, we can take them now. I do have a wrap-up question though, so, no pressure, no. It comes back on and off, thank you. Yes, ma'am. See, we do have Mariana wants to follow that.
It's not a question. It's just, I just wanted to share something I learned from my friend, Broderick Crawford. He was a mover and shaker. He wouldn't stand for less than he thought it was fair. And he was not afraid to do that. And he always would do it in partnership. He will look at those alliances and say, hey, I have this idea. I want to do this for our community. Let's do it together. And then after the invitation, he will always ask, what can I do for you? So that's a great lesson that I learned from him. And I think to date, I continue to use.
After the invitation, what can I do for you? I think that's a good lesson for us all just in life. When we ask someone to do something, I'm going to try that with my kids tonight, but they ask for too many things. What can I do for you? Like some cookies. Well, in the last couple of minutes that we have, I would like to first thank you again. Thank you so much. I feel like your expertise, yes. And just being vulnerable about some of the challenges that you faced. It's not always easy to talk about the things that you've discussed today, so I appreciate every one of you for being here. What is the most valuable lesson that you've learned along the way in your work as a community member working with clinicians, or on the other side as a clinician working with community? The most valuable lesson, you could take a minute to think if you need to, and I'll just pass this on down.
2 quick ones. For the young people in the room, build your network now. It's the only thing that's going to move with you. And for everybody, just show up. Just show up. There might be one community meeting, you have no idea where you're going. It's a 45-minute drive to get there. Show up. There's always that one person that you meet that'll change your entire perspective. And I can't tell you how many times I've had that experience. Just showing up and being present can absolutely be worth it.
I will say that you just never know what you're going to hear, but that should not stop you from asking the question. I always feel intimidated when it's something that I'm not fully confident about, but I don't think there's enough time to be confident about everything before you start asking questions.
I agree with everything you two said, but just be present, be in that room. And he asked about how can we be on both sides of the state lines at the same time? It's called a car. Or Zoom, I'm being honest. So Yeah, just be present and be willing to hear people out. And if you're anything like me, just don't take no for an answer.
I guess listen and trust your gut. Look for signs and symbols as well as words, because people sometimes, I used to give a lecture when I taught at KU about eye rolling. Don't do that. Just don't do that. Because it says more about you than it does about the others. I would like to issue an invitation, if that's all right, to Community Together. And if you'd like to be on the list, just let me know. There's no invitation to this. You can bring somebody with you. It is the next one is April 3rd. It's a Thursday from 8:30 to 10:30 at the Kauffman Foundation. They do provide breakfast. And it's the same every time. And yeah, 8:30 to 10:30, April 3rd. And if you want to be on the list, let me know.
She is selling herself. She is a cook. She brings everyone. When what she's inviting you to, when you walk in there, I say the first 15 minutes is like, oh, okay. I say within the next 30 minutes, you're like, where all these people come from? And so she brings people together, and she runs it like an iron horse. I mean, ironclad. So but she's selling herself really, really, really short. But sweet.
Humility.
Well, thank you all so much for the wisdom and the insight that you shared with us today. And now we have a better look under the hood of what makes the magic work. So thank you all so much. And thank you.